April 10th is National Youth HIV and AIDS Awareness Day. HIV stands for Human Immune Deficiency Virus. It's a virus that spreads through bodily fluids and enters the bloodstream. Bodily fluids that can transmit HIV are blood, semen, preseminal fluids, precum, vaginal or rectal fluids, and breast milk. It is not spread through fluids like sweat or saliva. HIV is not transmitted through casual contact, like hugging, kissing, or sharing household objects. Once in the bloodstream, HIV turns the body into a virus factory. It hijacks the body's white blood cells to produce more virus cells. White blood cells are responsible for fighting germs that enter the body. Because HIV targets white blood cells, people living with HIV will have weakened immune systems without proper treatment. HIV can progress to AIDS, acquired immunodeficiency syndrome, when the virus has severely weakened the immune system, causing the number of CD4 cells, white blood cells, to drop below 200 cells per cubic millimeter of blood. At this point, the body is unable to fight off infections. This leads to the development of serious illnesses known as opportunistic infections, such as tuberculosis, pneumonia, and certain cancers. When a person takes their medication exactly as prescribed, they can achieve an undetectable viral load. HIV medication does not cure HIV, but helps reduce the amount of HIV in the blood to less than 200 copies of HIV per milliliter of blood. When the viral load is low, the standard lab test can't detect it. A person with an undetectable viral load has a healthier immune system and is unable to transmit HIV to other people through sex. In other words, undetectable equals untransmittable. Ongoing adherence to treatment is essential. According to the CDC, in 2020, youth ages 13 to 24 accounted for 20% of all new HIV diagnoses in the United States. In 2022, the CDC found out that of every 100 people with HIV, only 87 knew they had it. This means that they are not getting the treatment they need to stay healthy and are also more likely to transmit HIV to others. Young people are less likely than other age groups to stay in treatment for HIV, which is understandable with the busy lives that many young people have. HIV prevention can be a way to stay healthy so you can stay on top of your life goals. HIV can affect anyone who is sexually active, which is why it's important to consider prevention methods. Some prevention methods include condom and dental dam use, regular testing and communication with your partners, and PrEP. PrEP stands for Pre-Exposure Prophylaxis. It is a medication that prevents the transmission of HIV by building up a level of protection in your body. PrEP can be taken as a daily pill or an injection that is received every other month. You are protected from HIV while taking PrEP. PrEP does not protect from other STIs or pregnancy, so it's important to continue using other prevention methods. Laws vary state by state, but in New York, minors aged from 12 and older can receive HIV and STI-related services, like testing and PrEP, without needing parental consent. It's important to note that charges from clinics can still appear on your insurance records. Talk to your doctor about your options. Come visit us at one of our locations. We provide free walk-in testing with no insurance, ID, or parental consent required. The only way to know your status is to get tested. Our education team is here to help.